Good afternoon. Thank you for coming. Welcome to Beebe Healthcare. We've asked for this press conference. There's a disturbing public health trend in the county that we believe citizens need to be aware of. Since last Thursday, so 6 days ago, we've seen more than 30 overdoses in our department and in our facility. In a typical period of time, we may typically see 5 in that period, so a significant increase. These patients are unique in that they are much more critically ill than most patients. Many of these are requiring long-term care in our intensive care units. This is a very disturbing trend. We don't know at this point exactly what the substance or combination of substances that these people are using. We certainly encourage our partners in the pre-hospital field and in the community to continue to use Narcan for these people. It seems to be very effective. I'll turn the mic over now.
Good afternoon. Thank you, Dr. Cowan. So I'm Dr. Paul Strzemski. I'm the Chief Physician Executive for Beebe Healthcare, and thank you for your time and your attention to this issue. As Dr. Cowan had mentioned, one of the concerns and the troubling aspects of this set of ingestions is the severity of the patients and the significant amount of agents that are needed to try to reverse it. The amount of Narcan, as well as the fact that a number of these patients, to date more than 11, that have required mechanical ventilation and intubation with ICU stays. Beebe is pleased and happy to partner with our colleagues at the Delaware Department of Health and Human Services, as well as the Delaware State Police, responding to this public health incident. We are grateful for their partnership. This is an incredibly fast-moving situation and public health concern that we and our community are dealing with. And we are proud to help with the safety precautions that are necessary and having them help us with the resources that we need to respond to this. We are working with investigators, and we are asking, even begging our community to watch out for each other and understand the significance of this condition. I'd like to hand it over now to Joanna Champy, who is the Director of DSAMS.
Good afternoon. My name is Joanna Champney, and I serve as the Division Director for the Division of Substance Abuse and Mental Health at the Delaware Department of Health and Social Services. In response to this emergent crisis, we have ramped up Narcan distribution in Sussex County by providing additional Narcan directly to Beebe Healthcare. Beebe was already a Narcan partner with DSAM, but this morning we delivered another 1,300 kits so that they can distribute Narcan throughout their healthcare system. We also delivered 200 doses to Beebe Hospital for their emergency department specifically. In partnership with Beebe, we are also distributing Narcan at various community outreach events. We already publish on the Help Us Here website the recurring Narcan training events that are open to the public, but the additional Sussex Narcan training events that we have added especially will be put on the Help Us Here homepage so that finding the information is as easy as possible for the community. Our Overdose Response Center has been coordinating community partner responses to do street outreach and to set up additional Narcan distribution. Our partners at this time include our DSAM bridge clinics, our police diversion program, addiction treatment providers, and naloxone distribution partners, which includes a wide variety of organization types. The Overdose Response Center continues to review the geographic locations of the overdoses in Sussex. There are no specific patterns at this time in regards to age, sex, or race when it comes to this spike, and the cases really are spread widely throughout the county, and so we are directing outreach to the areas where we are seeing the incidents. We want to thank the entire Beebe incident response team for keeping in constant communication with us so that we can coordinate our community outreach efforts throughout the county. We also want to point out that while the spikes that we are seeing are primarily in Sussex, the rest of the state should exert extreme caution as well, because the Poison Control Center issued a bulletin recently noting synthetic opioid derivatives in the eastern part of Delaware that carry similar symptoms, such as agitation and delirium, severe sedation and coma, respiratory depression, and movement abnormalities attributed to seizures. The Overdose Response Center yesterday issued the following guidance to treatment providers and community partners. Advise patients and clients that there is currently a potential increased risk in Sussex County of more severe overdose effects. Xylazine and fentanyl test strips may be requested with DSAM supplied Narcan kits. Please encourage your patients and clients to not use alone and recommend that they test their illicit substances. Repeat doses of naloxone may be necessary in these incidents to restore normal breathing. After breathing is restored, additional doses are not necessary to cause patients to become awake. Remember, naloxone is only to restore normal breathing, not necessarily to fully wake someone up. Early activation of 911 is vital in these cases. Clients and patients should be encouraged to accept treatment and transport to the emergency department for additional care that may be needed. The Overdose Response Center is looking for all available information on these and similar recent overdoses, including narrative and secondhand reports from clients or from field outreach or street intelligence. Our DSAM Bridge clinics are available in each county to support people who need help. We have brick and mortar locations that anyone can walk into, but I want to especially highlight the Sussex location, which is in the Thurman Adams State Service Center at 546 Bedford Street in Georgetown. There you can talk with a clinician about any substance use or mental health issue, regardless of your insurance status. HelpIsHereDE.com and Treatment Connection Online have provider directories that can point you towards help. And if you don't have insurance, you can still get state paid services. These providers are listed in our guide to accessing publicly funded treatment, also posted on HelpIsHereDE.com. Thank you, and I will now turn it over to Dr. Rob Rosenbaum, the Medical Director for Emergency Medical Services and Preparedness at the Division of Public Health.
Thank you, Director Champney. My name is Robert Rosenbaum. I am the Medical Director for EMS and Preparedness for the state of Delaware. Safety of people administering Narcan has been a concern expressed in the public. The question people have is, am I putting myself at risk if I administer Narcan to somebody who has taken this drug? Questions about gloves, skipping rescue breaths. Other questions have come up. DHSS is working to obtain information about the drug's compounds and what that means for safety, and at this time, we don't have all the answers. But administering Narcan has not caused harm. Our usual advice to give Narcan if you suspect an opiate overdose has not changed. We hope to get more detailed information about the specific substance later today, and will then be able to issue guidance to public and to public health entities together through the Division of Public Health. With that, I'd like to hand it off to Dr. Bill Chasnoff, the Chief Health Systems Design Officer for Beebe Healthcare.
Thank you, everyone. Thanks to everyone who came out today, who will be watching this later, and to all our colleagues and peers from Beebe Healthcare in the state, represented behind me, beside me. Very proud to have you here. So I am Bill Chasnoff, Chief Health Systems Design Officer here at Beebe Healthcare. As Dr. Surzinski said, as Director Champney, as Dr. Rosenbaum had mentioned, this is very important that we all work together to identify how we can provide the best care to our community here in Sussex County and beyond, and to our patients that are seeking care really within the four walls of any of our facilities, be it the hospital or walk-ins, primary care offices, and other locations. So thank you all for being here. It's important to realize that Beebe Healthcare has partnered with DPH and DSAM and others, Delaware State Police, for years. And this is just showing how important these partnerships are to ensure that our community is taken care of. What I consider the beauty behind me, not sure if it will show up, the mobile unit is a behavioral health focused mobile unit out 6 days last week in order to make sure that education, Narcan kits, and other important information is provided to our community, meeting them truly where they are. That is from a partnership with all of you to make sure that these community interactions happen and keep us all safe. We're also, it's very important for us to make sure that our colleagues, our care teams are taken care of and ensure that they have what they need to take care of our community members and patients. We have been educating system-wide around something called personal protective equipment to make sure that we are keeping ourselves safe, to be here to take care of all our future partners, patients, and community members. It's important to realize that exposure to illicit drugs can occur outside emergency departments. They can happen at any point of contact, be it from a mobile unit, a walk-in, or other facilities and places. It is our responsibility with all of you to make sure that we empower our team members and others to know what to do in these situations. So thank you again, and it is my pleasure to turn this to my colleague, Kim Blanche.
Good afternoon, everyone. Thank you again for being here. My name is Kim Blanche, and as Director of Community Outreach, I want to ensure that our community is prepared to assist their friends and loved ones in the event that they encounter an overdose before medical professionals can arrive on the scene. Our mobile health clinic and mobile outreach teams serve numerous organizations throughout Sussex County with a focus on behavioral health and harm reduction, as Dr. Chasanoff mentioned. And it's through great partnership that we are able to do this. And those partnerships continue as we are out in the community, as was mentioned, literally meeting people where they are, as that trusted door through our community partners and their long-established relationships. At a recent event at 4:30 in the morning, the mobile outreach team, the behavioral health nurse, and a peer on the mobile unit encountered an individual, a young woman who was pregnant and sleeping in a dumpster. And this individual, this young woman, was not seeking care from the facility nearby, but found a trusted resource in our behavioral health team. She was then connected to the appropriate services, was relocated on her own to Dover, and has been able to secure safe housing. She called and thanked the team for saving her life. And this is what this work is doing out in the community, is saving lives one at a time through the incredible efforts of our outreach teams. If you or someone you know is experiencing an overdose, call 911 immediately. If you have Narcan or naloxone, administer it. Utilize caution if you see any powdery substance on or around an individual experiencing an overdose. And thanks to DSAM and our incredible partnership with DSAM and their amazing teams, our amazing team is out there right now working the community in serving them, distributing Narcan, and training them on how to identify an overdose. It's incredible activity happening right now, particularly in the Millsboro area where they are focusing their efforts today. Please, when you have a moment, go to beebehealthcare.org/calendar, and there you will be able to find our Narcan pods, points of distribution. They'll be located on our events page on beebehealthcare.org. If you have any questions, please reach out to our community outreach team at 645, area code 302, of course, 645-3100, extension 70601. And again, thanks to the incredible partnership with DSAM, these pods will also be posted on their Help Us Here Delaware website. Thank you. And I have the pleasure of handing this over to Dr. Tam, our CEO and president.
Thank you, Kim. I'm Dr. David Tam, President and CEO of Beebe Healthcare, and thank you so much for coming here today, because this is a continuation of a health crisis that we have seen over many years, despite the efforts of healthcare organizations and certainly our state partners in doing this. But it is a war that continues to change, and as you have seen and heard, it recently changed again with a change in whatever the pharmacology is or whatever, and it will continue to do so. That's one of the reasons why we wanted to have this press conference, to raise awareness in the community. Unlike COVID, which we all dealt with, nobody's wearing a mask, right? Nobody is isolating. And although the story that Kim told was very touching, and we have many of those, drug addiction chemical addiction, depression, and anxiety actually afflict all of us in one way or another. Whether you have a lot of money or you are a homeless person, the chances are you know someone who is addicted and someone who has trouble with this kind of problem. I know that for a fact because here at Beebe Healthcare, we focus on making sure that we are here for everybody. I know that this is a press conference and all the cameras are facing this way, and I'm so glad because you see the people behind me who work every single day to make Sussex County safer and healthier. But later on, as you're doing your B rolls or whatever, you'll see there are ambulances that come into our emergency room, dropping patients off from places like Dagsboro, Millsboro, Millville, that are far away and rely upon Beebe Healthcare to provide the services that the patients need in order to have better health. I know for a fact that, and many of you have asked me about it, so I'm going a little bit off script here, that March 8th, I had a stroke. I had a stroke right here. Thank God I was near our emergency room and I got taken care of. And as you can see, I'm grateful to this team, many of them who were there on that day, as well as the organization that I'm standing here in front of you and I'm able to hold the mic and speak to you. That is the value of this partnership that we have with the government, with the state, and this organization that is Beebe Healthcare, where we have to continue to invest in our growth, that we have to continue to be strong because we have a community that is growing more and more every day. But for today, it's about the war on drugs and the medical issues that relate to it. And I hope that you can take this information everywhere you go, that it is something that afflicts everybody, that it continues to evolve. Reach out to the state, to DSAM, as well as to Beebe Healthcare to learn the most about what we can do. And together, we will be able to continue to grow and develop in our fight, in our battle against this terrible problem. Thank you so much for helping us spread the news, spread the information, because unlike COVID, there's no vaccine for this. It's about information, it's about awareness, and working together so that we can make sure that people are as healthy as possible here in Sussex County, as well as throughout the state of Delaware. On that note, I'd like to thank you for coming, but I will be ready to answer any questions that you have if you'd like to do so.